Welcome to today's webinar and happy National Caregiver Day. My name is Nora Spinks. I'm the CEO of the Vanier Institute of the Family, and I am delighted and honored to be moderating this panel conversation on experiences in caregiving during COVID-19. What have we learned? In Canada, the first Tuesday of every April is set aside to recognize caregivers and their extraordinary contribution that they make to the very fabric of our country. It is in that spirit that we have assembled an extraordinary panel of Canadians who know family care. Caregiving has touched each of us, both personally and professionally. This session is hosted by AgeWell, Canada's Technology and Aging Network, in collaboration with Carers Canada, the Vanier Institute of the Family, and the University of Alberta. It's my pleasure to welcome Ron Beleno, Catherine Suridjan, and Janet Fast. They will share their stories, their caregiving experiences, their wisdom, and their insights. They will share what they have learned about how pandemic has affected caregivers. They will speak frankly about what works and what's not working. They are committed to providing you with information that you can apply, insights that you can consider, and inspiration that will excite you. I invite you and engage you to join us in chat by sharing your experiences and participating in the poll questions that we will be sharing with you shortly. The team will be managed by chat moderators Dorina, Nathan, and Carolina. You will also can engage on social media with a variety of hashtags that are available in the chat. So to get started, let's begin with you, Ron. You are the chair of AgeWell and the Older Adult and Caregiving Advisory Committee. Can you tell us a little bit about AgeWell, our sponsor of today's webinar?
Yeah, thanks, Nora there. And hi, everyone, and happy National Caregiver Day to all of you. So regarding AgeWell, AgeWell is a unique Canadian network that brings over 250 researchers, 420 partners, and more importantly, close to 5,000 older adults and caregivers together to develop technologies and services for healthy aging. AgeWell aims to move the dial when it comes to supporting older adults and caregivers in Canada. And that's through a co-creation approach to technology development. The goal is to achieve social and economic impacts. AgeWell is supporting right now at least over 54 different startups, and as well training the next generation of innovators in the field of technology and aging. And that's making Canada a world leader in technologies that help older adults, older people everywhere to age well and live well. And within my community of the Committee of the Older Adult and Caregiver Advisory Committee, we are there to give the voice of older adults and, myself being a caregiver, the voice of caregivers with innovators and academics within the AgeWell network. Nora, I think you're going to start owing some money.
Thanks, Ron. For every time we say mute, or I was on mute, or sorry, you're on mute, we figure $1 in the pot and we'd never have to fundraise again. So thank you for reminding me. I will start my tab at this moment. Thanks, Ron, for that brief introduction to AgeWell. And for those of you who have not yet been to the website, please do so. There is a wealth of information there. We are asking each of you as participants to indicate in the chat box in a word or two, what are you hoping to learn from today's session? So if you could just put a word or two in chat, that would be awesome. Catherine, as Director of Policy and Knowledge Translation at the Canadian Home Care Association, which is the organization which leads Carers Canada, a national coalition of organizations dedicated to increasing recognition and support for caregivers, your vision is a Canada that recognizes, respects, and values the integral role of caregivers in society. CARES Canada leads federal advocacy initiatives and national awareness campaigns. In fact, you are instrumental in setting the theme for this year's National Caregiver Day, experiences in caregiving. Can you tell us why this is important right now as we mark the first anniversary of the COVID-19 pandemic? Catherine.
Thanks, Nora, and thank you everyone for having me today on National Caregiver Day. So the theme this year is all about making caregiving visible. As you know, now more than ever, we need to keep our caregivers at the forefront of our minds and make sure that they are taken care of too. Through the campaign, we want to shed light on the incredible diversity of Canadians' experiences in caregiving. Experiences that are unique to this individual. They are shaped by what caregivers think and know, their heads, how they feel, their hearts, and what they do, their hands. In shaping this campaign, we learned that people feel more comfortable talking about the fact that they are caregiving than they do taking on the label of caregiver. And of course, because they identify themselves first as caring husband, wife, daughter, son, grandchild, friend, or neighbor. But if people don't realize they are caregiving, what are the chances that they will ask for help with caregiving tasks? What is the likelihood that they might seek respite services or simply reach out to a friend to vent? So we recognize that caregiver self-identification seems like a critical building block in the foundation of a positive caregiving experience. And we hope through this campaign, by sharing personal stories that talk about the different aspects of caregiving, the head, the heart, and the hands, more people will self-identify, realize that they're not alone, and are connected to the support that they need earlier than later. And with that in mind, we also shape our campaign message so it would not only reach those who are caregiving, but also those around caregivers who might serve as a catalyst for connecting caregivers to support. We believe that, the aha moment, wow, I guess I'm a caregiver or I am caregiving, would be equally powerful if it was, oh, my mom, my coworker, or my friend is totally a caregiver, and what can we do to support them?
Thank you, Catherine. Ron, as a family caregiver, you cared for your dad for more than 10 years, and he was living with Alzheimer's disease. And now you care for your mom, who's living independently on her own, along with her cat, Lucky. As she grows older, you remain a staunch supporter and advocate for family caregivers. Tell us what your experiences in family caregiving means to you.
So yes, I was a caregiver and still am a caregiver. My time caregiving for my dad over 10 years taught me a lot about that role. For many years, just like as Catherine was saying, I actually didn't use the label caregiver. What was more important for me, and it is important to know the term caregiver, but more important for me was the action of caregiving, which is also what Catherine mentioned, that as a son, I was caregiving, to support my father and his life. I support my mom, not as challenging. She does have that cat Lucky, who apparently is more her favorite over me, but that's okay, I'll accept that. But with regards to the caregiving role, that is simply caring for another human being, supporting them in their lives. And that's what many people have discovered, especially now during COVID. COVID is, even though it's ugly, it has taught us how to care for each other, care as individuals and care as a community. So for me, it's simply about supporting someone else in their life. And that's also supporting the caregivers. So many of you out there who may not consider yourself a caregiver, you are, in a position that you can care for a caregiver. And that is just like caregiving, in my opinion, okay? So that's what it means to me. It's the actions of supporting someone in their life in whatever way we can. And that's what I do. And that's what I believe many who are on the call here are doing day in and day out. Some not aware of it, but yeah, That's my view.
Great, thank you, Ron. Clearly what COVID has taught us is that caregiving is a team sport, and nobody's doing this on their own. And the stronger the team and the more supportive they are of each other, the much better it will be for everybody. Janet, over to you. You are a professor in the Department of Human Ecology at the University of Alberta. As an applied economist, your work has focused around the intersection between caregiving and paid work, the invisible costs and contributions of family care. You are also a former caregiver to your parents at the end of their lives. Now, as someone who has studied family caregiving and its impact on families for nearly 3 decades, what does experiences in family caregiving mean to you in this period of pandemic?
Thanks, Nora. I think at its core, caregiving is about caring about and caring for a family member or friend who needs support. And that's referencing what Catherine mentioned as the heart and the hands. So hands-on help with everything from helping the person to stay connected to their social network, to get out and enjoy the community or whatever they're able to do and wish to do, to helping manage medications and even do medical procedures like catheterization and intravenous therapy. But it's also about being in relationship with the person that you're caring for and working on that relationship, protecting that relationship as well. And in fact, it's the caring about that distinguishes the care that family members and friends provide from the care that formal carers or paid carers, for example, from a home care agency provide. My team and I have been studying caregiving for a very long time, both with some really great national data from Statistics Canada, but also by connecting directly with caregivers on a regular basis. And one of the main things that we've learned is something that Catherine also mentioned, which is that caregivers are incredibly diverse, but also that caregiving really touches everyone's lives. To paraphrase Rosalind Carter, if you haven't already been a caregiver, if you're not now a caregiver, you will be a caregiver in the future, or you will need a caregiver in the future. So again, it's something that touches everyone's lives. And as Nora said, we are, or we at least should be, all in this together. We've learned a lot about some of the common experiences that caregivers have, that they share, but we've also learned about the diversity, about the differences across caregivers. One very small example. We know that from the data, caregivers spend an average of 3 to 5 hours a week providing care to the person they're caring for. That's all caregivers in Canada. But as I also always tell my students, averages hide at least as much as they reveal. And if we look closer at the data, we see that, you know, substantial minorities of caregivers are reporting that they're providing 20 or 30 or 40 hours a week of care. So there's a lot of diversity, even in something as simple as how much time one spends a week on care tasks. And as an economist, when I see those numbers, I can't help but ask, so what are the financial implications of that? And what is, if we were to try to put a dollar value on that, what would that look like? And the last time I asked myself that question, I estimated that if you had to replace all of that care that family members and friends were doing, that with hired help, that all that free labor with hired help, it would cost about $66.5 billion.
Dollar in the pot. Thank you, Janet, for for that enormous number. It puts into context a lot of what we are seeing in families and in communities. And one of the things that some data that we just got in this morning shows is that over COVID, families feel closer together. And the majority of families in Canada, US, and Mexico are finding them coming closer together, and that the caring about and the caring for is what's helping to get through pandemic, ironically enough. So thank you so much for that. I'm going to ask participants just one more poll question in this round. And this time we're going to ask, how many years have you provided care over the course of your lifetime? So think about adults, think about seniors, think about people in your life with disabilities. Think about all of that time combined. How many years have you provided care in your lifetime? Less than 1, 1 to 5, 6 to 10, or more than 10 years. Do the quick math in your head. And Dorina, when you have the results, you can show us how many years people are providing care. This shared experience has become heightened, magnified, amplified, and intensified during COVID. It's one of those things that is important for us to understand. And as the data shows here in front of us, over 40% are doing this long haul, long term. And what the data shows is that often it's with joy and honor and pleasure to do so, provided that the supports and resources are available to allow them to do that. There are a number of papers that we will be directing you to through chat. Please feel free to look at those later on, and we'll make sure that all of these links are available to you post conference. Now, what we have recognized is that every system in the country, whether it be healthcare, long-term care, justice, child welfare, education, every system has been disrupted. And long-term care and home care systems are two of those that impact caregivers most directly. Now, every system in this past year, with all of this disruption, has had its strengths and equally its weaknesses magnified, amplified, and intensified. So Ron, I'm going to ask you how your experiences as a caregiver has been impacted by pandemic and how that experience has changed as a result of public health measures or things that we're dealing with as we're responding to pandemic around the world. Ron?
Yeah, so Nora, so for me on the conversation regarding long-term care, I personally don't have a connection and a history to that, but I do spend a lot of time, connecting with caregivers all across Canada. That's an easy one. Everyone sees it in the news. We failed, even pre-pandemic with long-term care. Okay, there's windows and pockets of policy change and opportunities right now that will be happening. So we have to take advantage of that. So that's in that space. For myself, personally, it hasn't been that bad in my personal world. I've been fortunate. Again, I have a mother that's quite independent. So that's me personally, but I do spend a lot of time with other caregivers that are in the home. That information you shared, Nora, just recently about how families are bonding a little better right now. I see that, but I also see on the other end, the families that don't have the resources, the supports, it's actually intensifying. It's actually becoming worse. Caregivers and the person they care for are more edgier, let's say, with each other, and not a very healthy environment for that. So that is what I'm noticing. One thing I keep promoting to many is this phrase I like to use is the ability to spread the stress. Okay, technically caregiving is dealing with life's challenges, and during this pandemic, some of them could be the ADLs, the activities of daily living that some people aren't aware of, the basics of taking care of food, meals, getting nutrition, in the home, from cleaning, from bathing. Sometimes many families are not receiving that personal support worker or healthcare aid, depending where you're in Canada, because of safety. So it's now back to the caregiver to take care of these activities of daily living, which becomes stressful. So my phrase is, spread this stress to increase caring success. And simply put is, how do you spread that? You could spread it by supports with others if you can bring them in, but using technology, communication tools. We've done that with long-term care. We've done it in the home. We're doing it now. Chances are we would not, years ago, we wouldn't have this as a Zoom call. This would be in person. But now we could bring caregivers and others around Canada and even internationally here today to be able to get that education information. So that's what I'm sensing, that we're just trying to deal with new challenges during this pandemic, and how do we, overcome them. I don't have one answer, but it's that mindset to caregivers that I'm suggesting, and those that support caregivers, is to how do you spread that stress? How do you reduce that? Make them some meals. Give them at least, 1 or 2 extra free meals that they don't have to worry about a week. That's spreading and reducing that stress. So that's kind of my thoughts around the pandemic at this moment. Another $1, Nora. We're at $5, I think.
Into the pot. Having been a caregiver during COVID, the being alone and lonely is a big part of the caregiving experience, but also finding independence and flexibility in order to have a life while you're providing care. And one of the simplest and most effective tools that I used in this past year was a simple, ordinary wireless doorbell. And my mother had the little ding dong part that's normally outside by the door, and I had the sound part that went wing wong every time she needed something. And I had space and she had space, low cost, near no cost, but huge gains. So Janet, as someone who's been studying caregiving and the caregiving experience, what have you uncovered as you continue to study caregiving during pandemic?
Well, I guess for the most part, I can say ditto to the things that that Ron pointed out. What the data are showing, there's been a lot of research activity around COVID and its impact on various people, including caregivers. And what the data are showing is that caregivers are both doing more and doing less. So people who are caring for someone who's living in the community are providing more care, both because the already tight supply of home care services is even tighter now, and has to go around many more users, but also because people are hesitant caregivers are hesitant to bring formal caregivers into the home because they don't know. I mean, those caregivers are visiting many different homes, and so they're worried about the risk of spreading the virus to the person receiving the care. But for those who are caring for someone living in long-term care, for example, or other residential care situations, the experience couldn't be more different. As Nora said, some of those people, and as Ron said, some of those people are just being shut out. They can't get in. They can't support the person, their family member or friend who's living in that long-term care facility, and so they worry. They can't see what's going on. They don't know what's going on. They can't provide the additional support that family carers provide to people in long-term care. And so a lot of the residents are falling through the cracks and are suffering for the experience. But regardless, in either case, the stress and the mental health implications, and as Nora pointed out, for many, the social isolation has really been ratcheted up because of COVID. One of the challenges that I study closely is having to combine care work with paid work. And there's no question that that's been affected by the pandemic as well. Work at home orders, job losses because businesses have closed, homeschooling, providing care under much more difficult circumstances. All of those things are making it much more difficult to combine work and care, especially for women. One Royal Bank report said that the COVID pandemic has wiped out some 30 years of gains that women have made in employment security and equity and financial independence and financial security. So the implications are many and widespread.
Thank you. Catherine, as someone whose organization advocates for caregiving, and you are a founding member of the International Alliance of Care Organizations, which is a global initiative championing caregiver rights, what have you learned? We're hearing about an increase in family presence policies being put in place in long-term care facilities, access rights for family members in long-term care and in hospitals. Tell us a little bit about what you've learned during pandemic in particular.
Yeah, so what we learned through our global survey very much mirror what Janet and Ron have also mentioned. So while caregivers have not been alone in experiencing the pressure of the pandemic, but many really face challenges, demands, and time commitment that are hard for others to understand unless they have experienced it. And Nora, you spoke to this earlier, how many caregivers feeling alone, right? And Janet mentioned that those primary defense that was put in place to limit the spread of COVID-19, such as the shuttering of home care services and support services to individuals' home, physical distancing, and restricted access to families in long-term care or retirement home, they have really created unintended consequences to our caregivers. So through a global survey of 12 countries, Canada, along with US, UK, France, Taiwan, India, China, to name only a few, it shows that the pandemic has placed an increased reliance on our caregivers more than ever before. And essentially, due to COVID-19, many caregivers have to do more with less, and making their caregiving journey harder for both the caregivers that are living together with the care recipient, but also those caring from a distance. And we also learned that because of the pandemic, 12% of Canadian caregivers began their caring duties for the first time. And compared to the 12-country global average, caregivers in Canada were found to be more likely to provide emotional support, managing doctor appointments, as well as home care responsibilities. And Ron touched upon this, is all the APL, providing personal care and doing medical tasks. And the demand of caregivers' time increased by 28% on average, from 16 to 26 hours of caregiving per week. And this is in addition to, like Janet also touched upon earlier, in balancing their personal and family lives as well as their paid work responsibilities. And as these responsibilities increase, they're finding fewer opportunities to take breaks, and their own needs are taking backseat and being neglected. So from the survey, we learned that 71% say that they feel more burnt out than ever before. And then there are even more nuanced challenges when we're looking at female caregivers and also those taking care of someone with ongoing cognitive health condition. So overall, in comparison to the 12-country average, there's higher incidence of Canadian caregivers feeling their physical, emotional, and mental well-being, as well as their financial well-being, have worsened since the pandemic. So isolation, lack of support, lack of sleep, having to reduce working hours due to caregiving duties, and adopting uneating healthy habits are some of the contributing factors to Canadian caregivers' worsening well-being. And then this also then brings me to the role of technology in supporting caregivers. Technology is advancing at a rapid pace, And through the pandemic and through the survey, we learned that 52% of caregivers are using more technology and digital tools to manage care, telemedicine, virtual medical appointment, as well as managing the technology needed for the care recipient to keep in touch with their loved ones. But at the same time, with the surge in this technology use, the survey also told us that 55% of caregivers, they want additional guidance and training on how to use these different technology tools for caregiving.
Thank you, Catherine. I know one time I had a personal support worker come in, so I rushed to the grocery store and got stuck in line and was unable to get the groceries done before the caregiver or the PSW was supposed to leave. So the following week, I arranged to have grocery pickup instead, so it would take less time. And my availability and the pickup time didn't coincide. So we went 2 weeks without groceries and ended up having to rely on neighbors and friends and others to provide us with food. We're going to ask you one more poll question specifically about technology. So Dorina, can you put the next poll up? We want to know, what technologies have you used during pandemic to help you with caregiving? Communications technologies, internet-based technologies, any alerts or sensors, and any other you can put in the chat. So check as many as you might have experienced: computers, tablets, smartphones, resource platforms, alert buttons, sensors, medication management technologies. Anything? And a couple of others: telephone check-ins, phone-based, just regular, rhythmic, predictable. I tell you, if I didn't have my 5 o'clock call with my sister, that was my lifeline. Basic telephone call every single day. Predictable, manageable, predictable. Okay, and the results of that poll are obviously computer technology, thank goodness for that. Internet-based platforms, and then a couple of others in terms of baby monitoring and cameras and the like. So thank you for that. There's a lot of growth happening in the space of technologies. Janet, as an AgeWell researcher, what does technology use and adoption look like for caregivers in Canada?
Saved myself $1. Well, even pre-COVID, we saw that most caregivers were using various kinds of technologies in various ways in their everyday lives, but not as many of them were using them to manage their care responsibilities. But certainly the pandemic has forced caregivers to look to technology for various functions to support their caregiving, as you said, online shopping, telecommunications, either monitoring the person that they're caring for in their own home, or communicating with other family members or with the person they're caring for, and so on. So there are many different ways in which caregivers have begun to embrace technology, even those who didn't use it before. At the same time, we know that the digital divide is a real thing. Often we think about the digital divide as being between generations, and that older people are less capable of using digital technologies, either for themselves or in their caregiving roles. But in fact, what we found in our research is that age is not really the defining factor. There are still some age differences, but the gap is closing really quickly. And the more important factors in terms of being able or not to use technologies are things like education, employment status, and affordability. So income is a big predictor. So poor digital skills are not the only barrier. What we're finding too is that some caregivers don't have access to the internet, for example. In rural and remote parts of our country, the infrastructure just isn't there. Others don't have access to the technology because they can't afford either to buy the devices or to subscribe to a service. Canada is sort of infamous for overpricing of cell services, for example. And equally important, I think, is that very often technologies are not designed for caregivers. And they're designed at best for the care receiver to help the care receiver function better in their daily lives, but often they're designed for the designer. You know, if we build it, they will come, and we must build it because we can. And so what AgeWell is doing, I think, that is really important is kind of going back to fundamentals and saying, look, we need to design technologies that actually work for the people who are going to use them. And I think that's something that they've pounded into the team members' heads, and I think the product developers and the engineers and the OTs and so on who are inventing stuff really are paying attention to that, and it does make a difference in the way in which technology functions in people's everyday lives, and the ability that caregivers have to take up the technology. Some progress is being made on the infrastructure front. The federal government has made a concerted effort to expand internet access around the country. There still is work to be done, but things are moving in that direction. But technology is only one of the tools in the toolbox, and it's an important tool. And obviously during the pandemic, it's a hugely important tool. But as one of my colleagues, Paul Burstow, who's currently a professor at the University of Birmingham in England, and is also very much involved in the Employers for Carers program of Carers UK, once said that getting the balance right between tech and touch is vital. And that means involving caregivers and older adults in the design and development process so that it actually meets their needs.
Thank you, Janet. Just a quick question from the participants while I still have you, Janet. Do you think companies should play a bigger role in helping their employees find and afford home care?
Well, I certainly believe that employers need to and should be paying attention to the fact that they could support their caregiver employees way better than they do. Some of our own research showed that employers either weren't aware that they had employed carers in their workplaces, they didn't care, or they thought that the supports that they were providing in terms of family-friendly measures like workplace flexibility and those sorts of things were sufficient to support anyone with any kind of family responsibility. And we know that that simply isn't the case. So yes, I think employers need to step up and need to be more supportive of their caregiver employees. There are many ways in which to do that. One of the things that some employers are doing is providing that kind of service finding support, helping people to find support services in the community and so on. But there are lots of other ways that employers can be more involved in supporting and there's a financial reason for them to do it. We know that doing that reduces absenteeism, reduces turnover, reduces what's called presenteeism, being distracted even while you're at work. And that all costs employers money if they don't.
Thank you. We know that the federal government just recently announced some major funding in what's referred to as the cell gap, the covering the cell service access in rural, remote, and northern Canada. So hopefully some of that will be addressed. But Catherine, I want to go to you for a minute. As part of your experiences in caregiving campaign, you've collected stories from diverse caregivers all across Canada. What are you hearing about in their stories about technology? And from one of the participants, how can technology and virtual care services be improved to help caregivers in providing care?
Yeah. So we collected over 30 stories from individuals across Canada. And from the stories we are hearing, as well as a lot of Janet and HUL research as well, technology is helping caregivers in different ways. So one, we found that technology helps caregivers achieve their personal goal and build confidence. You know, a caregiver told us in the interview that caregiving is its own trade. And more often than not, you're not prepared with the right tools. And technology has really helped caregivers to access the resources and the tools that they need to feel prepared and be well informed, to find the resources for the person that they're caring for, but also for themselves as the caregivers. And caregivers across all ages through our interviews and stories says that technology helped them to become avid researchers and to integrate their care responsibilities with the rest of their lives. A 14-year-old girl actually shared with us that the internet has been a great resource for me. And she continued to explain, you can really find anything online. And I use it to research what I can do to practice mindfulness and reduce my anxiety. So that brings up to my second point of how technology helps caregivers' emotional and mental well-being. During the pandemic, we learned that 44% of caregivers expressed that physical distancing has made them feel isolated and alone. 34% of the caregivers feel that they have no one to turn to for support. And technology has allowed them to somewhat maintain their support system, to keep in touch with friends and family, but as well as finding and connecting with other caregivers they are going through similar experiences. So a caregiver caring for her husband said, and I quote, I was introduced to an online support group of wives whose husband had the same condition, and this became my outlet for sharing my daily experiences with caregiving to people who understood. It was my greatest emotional release. And lastly, technology has also been instrumental in supporting caregivers in their roles to better manage both physical and emotional support that the care recipient needs. A common experience that many caregivers shared during our interviews is a constant worry of the person's safety. They'll share with me, my thoughts and anxiety would consume me. You're always waiting for to knock on the door. You sleep, but you don't sleep. So Nora, you spoke about this too, and I know Ron will talk about this too, that technology solutions that offer peace of mind, such as in-home monitoring or alert system, are what caregivers have found very helpful. We also want tools to ensure medications are managed accurately and with ease. With many participants in the circle of care, caregivers are also looking for easy-to-use platform to help them coordinate better between healthcare members, but also among family members. And this becomes more important too with distance caregiving. And a couple of the caregivers we interviewed also shared that since COVID, technology allowed the person they are caring for to engage with others through a virtual support group over Zoom, which is actually something that the care recipient would not have otherwise done in person. And this has provided a relief to the caregivers, seeing that their loved one making greater strides through social engagement and knowing that a simple Zoom call was providing some emotional support. So in answering the questions from one of the participants, I think technology has definitely played a role in enhancing caregiving experiences. However, as Janet mentioned, it is important to make sure that as we expand caregivers' use of technology, we're seeing technology designed with caregivers in mind. And that means putting caregivers at the center of the design process and aiming to meet their needs and aspirations, and recognizing that caregivers may have different needs and expectations when it comes to technology.
$6. For those of you who are following chat, there are also a number of suggestions coming into chat, and we will be bringing those together and circulating them to all participants. Ron, I'm going to give you the last question. In fact, it's going to be a two-part question. You know, you're known by some people as the MacGyver of caregivers. It's a reference to a character of a TV show in the mid-'80s, although there was a remake of it not so long ago, who basically was able to do anything, make anything out of what's ever around him, and to solve any problem out of using just ordinary mundane materials at hand. So I'm going to ask you to share your views on technology, and I'm going to ask you to keep your remarks down to 2 minutes, and then follow that up with how you would complete the phrase, wouldn't it be great if? And I want to pose that question to participants. And while we're in this last 5 minutes together, how would you complete the phrase, wouldn't it be great if? So, Mr. MacGyver.
Thanks. I'll keep this simple there, Nora. First, the MacGyvers, I like MacGyver 1.0, okay, Richard Dean Anderson, the guy with the mullet, okay, so bringing back the mullet. Technology to me is simply tools, okay, so everyone has to understand, rephrase that term, sometimes technology is what tool will get the job done, okay. This is as powerful as any other tool. A Post-it note, okay, was very powerful in my world, okay. That to me, you know, could be considered technology if need be. So consider technology as a tool. It is one where, as I said as well, you could spread the stress with technology as a resource, okay? So the most popular one right now during the pandemic is remote care. Here at AgeWell, I actually have one here that I'm evaluating, okay? This is a camera sensor, but it's not any camera, okay? This is Ultim View. It's a Canadian company. And I used to use cameras to remotely watch my dad 10 years ago, but my mom was concerned. So technology also brings some bad stuff, okay? Privacy, ethical issues. We could have that conversation another day. This one converts my dad or my mom or anyone to a stick figure, okay? So you don't see their face, you don't see if they're naked. So I have this with about maybe 5 caregivers across Canada testing this out, putting it in bathrooms, okay? In places you would not put technology. So that's one way to look at technology as a tool. To answer your question with regards to wouldn't it be great, I actually have one that was mentioned earlier, employers, okay? Can employers become more aware? You know, this is the time to make employers aware about caregiving and supporting caregivers. The other thing is let's get the benefits from the pandemic, the pros, you know, make those changes. And last thing I wanted to share is wouldn't it be great if caregivers understood what's happening right now, that we have more care teams. The pandemic has taught us how to be a community of carers. So let's move that forward. You know, community caregiving is what I'm interested in as we move forward. Thanks, Nora.
Great. Thanks, Ron / MacGyver. Catherine, how would you complete the phrase, wouldn't it be great if?
Wouldn't it be great if we're all in this together? So whether you are a healthcare professional, researcher, policymaker, business executive, member of community group, family, or friend, wouldn't it be great if we all take pride in our caregivers and take part through our expertise and scope of work to empower caregivers so they do not only have the support that they need, but they also thrive as an individual, empowering them through going back to what I said in the beginning, what they know, their head, how they feel, their hearts, and what they do, their hands.
Thanks, Catherine. Janet, wouldn't it be great if? You're on mute. You owe $1.
Okay. Wouldn't it be great if we stopped talking about recognizing family caregivers as important care partners and started behaving as if they really were important, important contributors to the overall health and what the Brits refer to as social care system. Actually showing that recognition by doing things that actually supported them.
Great. Wouldn't it be great if we had more time, which we don't? Wouldn't it be great if we continued this conversation and that this was simply a catalytic moment that invited all of the 100 people who participated today to multiply this to their family and their friends and their community? Wouldn't it be great if we all came together again next year and we're able to reflect on what we learned during COVID and how much has changed between then and now in 2022. I want to thank everybody who was a part of this webinar today. Catherine, Ron, and Janet, thank you for your insights, your information. We promised participants new information, new perspectives and insights and inspiration, and I think you delivered. Thank you all so very much for that. Thank you to the participants and those who took an hour out of their day today, morning, afternoon, or late in the day across the country and around the world. Thank you for being here. Thank you for all the participants in the research who agreed to share their stories to the Carers Canada or to researchers around the world. Thank you to Dorina and Nathan and others who have been managing behind the scenes all the chats and the technology, and to all the folks at AgeWell who have participated in preparing for this, and for Jackie for keeping us all on time and all on target with the one document. So it's been a pleasure hanging out with you this afternoon. Big thank you. Wonderful being able to spend this hour with you. Congratulations to all of you caregivers as you navigate through pandemic. And thank you, Catherine, for the wisdom of your organization in helping us celebrate this through the partnership with AgeWell, University of Alberta, and the Vanier Institute. Thank you all so very much. Have a wonderful day. Don't forget to check out social media. We will make this available to you. Thank you all so very much. Have a great day. Bye, everybody.